So yesterday we completed with Hepar. In this list of comparison of drugs, we had actually four, calcarea carb and calcarea phos, which you have already learned, and then Causticum and Hepar. And we did both of the drugs. And in Causticum, we saw the complaints are mainly from mental emotions, the suppressions of those yeah, emotions, and also by extreme joy, fright, excited news, etc. And we also saw that in Causticum, most of the symptoms are in the nervous system, and there can be a paralysis. And if there is paralysis, then it will be single part or single organ, head to foot. Any paralysis can happen. So motor system functioning is usually affected. Then we saw that constitutionally or mentally, these people are very sympathetic. They can't bear injustice. Then we saw that they have a very dirty skin, a sallow skin with all crust formation on the skin, scars also, and they have a tendency for the scars or this any wound injury which have been healed to break open and then to produce skin eruptions, so oozing of the fluid once again from those scars. Then we saw that the um, other characteristics, symptom, because there can be epilepsy. So we saw that they will be having epilepsy, so no, showing a periodic nature. And then another important feature was in the GIT and urine. So both of that, there can be paralysis, and as a result, they have a separate or special attitude during defecation and also micturition. And then another important sphere of action was in musculoskeletal, but that also relating to their motor paralysis and also their epilepsy nature. So that was about Causticum. And then in Hepar, we saw that in total there were hypersensitive people, very hyperimpulsive, tendency to kill, and all the skin affections, which can end in suppuration. Even the touch of the cloth will be sensitive. Um, yeah, and mostly yes, that was the symptoms that we saw. So yeah, by the way, I didn't ask you. You're seeing my this one, right? The Word document. Yes, no issues now. Okay. So this was a mnemonic for H I made when I was studying for BHMS. Okay. So everything, 7 symptoms with H. And that gives the drug in total. Yeah, there are something that we have to still increase from here, like heavy sweating. It's not just sweating, you have to increase it to that, like expand it to there is sweating day and night, but there is no amelioration. You have to say that, like hypersensitive still in the mental and physical level, even that, yeah, fainting from the pain, everything to be added, but just this is one word from which you can expand. So the almost all the features of Hepar drug will be covered by these 7 features. The word hoarseness, it will give clue to the respiratory symptoms, the cough, hoarseness, the cough, croup, etc. And then from croup, you will get into asthma, the special attitude that is being adopted in asthma, the aggravation, amelioration. So it is the cold, dry air that it causes aggravation, but wet, damp weather, it is amelioration for them. So now going towards the comparisons. So comparisons, I told you these are the sections I wanted to discuss with you. So mind will do GIT, marasmus, and child. I have taken it together, but because all these 4 drugs, they are child drugs also. Calcarea carb, calcarea phos, causticum. They can just ask a essay question like causticum, describe a causticum child or anything. So when we say a child, it comes not just the child symptoms. Okay, we make the constitution to child, but all the other symptoms according to the suitability we should put over there. And whenever a question about child is asked, if that medicine is indicated in marasmus, we have to bring the marasmus. And marasmus, it indicates the protein energy malnutrition. So there will be some diarrhea, wasting symptoms also. So that is why I brought the GIT. So I clubbed GIT, marasmus, and the child together. So all the four remedies will be coming over there. And then the skin symptoms, we have only Hepar, Sulph, and Causticum mostly. Calcarea carb and Calcarea phos, we can give for skin complaints if we are getting the constitution. Otherwise, it is not specific to skin. Just because of some skin symptoms are there, we can give Calcarea carb or Calcarea phos. That's not the concept over here. We need to have the constitution. But Hepar and Causticum, if we have that symptoms that, as I told you, Hepar, the ulcers that we explained yesterday, or that hypersensitiveness, and in case of Causticum, the eruptions or the scars break opening again. So if we have that only, even if the whole constitution is not matching, we can give the Hepar and Causticum for skin complaints, but not Calcarea carb and Calcarea phos. There is nothing like special for Calcarea carb skin. If everything is suiting, then if that person develops some skin symptoms, we can give Calcarea carb or Calcarea phos. That's why I considered only these two remedies. And then female reproductive system is also there, Calcarea carb and Calcarea phos. They are having very important female symptoms, urinary symptoms. Okay, so starting with mind, with regard to Calcarea cup, their mind, they're very family persons, and they're very emotionally attached to their family. They're very anxious and fearful about health and security of not their own, their family also. They're very slow to comprehend new ideas or information. They are slightly idiotic persons, not extremely idiotic like Baraita Carb, etc., but they are slightly mentally, they are a bit slow in action or slow to comprehend. A jaded state, jaded means the loss of enthusiasm, whether is, and that can be in mental or physical plane due to overwork. There is a fear of loss of reason or that people will observe her mental confusion. So this person, they're very much anxious about their activity. They know that they're very slow in comprehending things, and they get into some confusion like that. So at that time, when people are very conscious about their own limitations, they get conscious whether these other people are noticing that they are loss of they are losing their reason, whether the people will be around them will be noticing that such confusion will be there. And they also fear of misfortune and contagious diseases. This fear of contagious diseases and even cancer we can see in another medicine, that is Sulph. Then they are forgetful, confused, low spirited, and obstinate people. When I say obstinate, another important remedy for obstinacy is silesia. But Calcarea carb is not as obstinate as silesia. Then we go to the Calcarea phos. Calcarea phos you should be remembering. Like Natramure, they are having ailments from grief, disappointed love, and like Ignatia, they have another symptom, that is involuntary sighing, because all the complaints are coming from that mental feature, especially during their teenage. But yeah, when we go to children, we do have the symptom that they have defective nutrition and assimilation. The bone growth is reduced. We will see that. But other than that, in the mental sphere, when we come into the teenage or adolescent, they have ailments from grief and disappointed love, and they feel complain more when thinking about them. And the other remedies, Helonius and oxalic acid, also Causticum. We'll come to it. And they always wants to go somewhere, somewhere outside. That's the meaning. And some other remedy we can compare over here is tuberculinum. Tuberculinum is also very cosmopolitan in nature. Like they also wants to travel a lot. They can't sit in one place. Not showing their restlessness. It showed their desire to travel, to discover world, or to travel around. So, like tuberculinum, that cosmopolitan nature, we have calcarea phos also. Then going towards causticum. So the causticum, they have do complaints from the severe mental shock and ailments from long-lasting grief, sudden emotions, and mostly all of these will be affecting the nervous system. So there will be disturbed functional activity of brain and spinal cord, which results in paralysis. So the mental symptoms is all the mental affections, either long continued or sudden emotions, that will be affecting the central nervous system, the brain and the spinal cord, and causing diseases or the motor paralysis. So that is the importance of the mind of Costrica, how it affects. But constitutionally, these people are very sympathetic. They have a strong sense of justice and desire to help those who are oppressed. And in children also, we have seen that they are very sympathetic. They can't bear the sadness or the sufferings of their fellow friends, and they feel like to they feel sadness and they cry also very intensely. But once that is in their childhood, when they are not able to do anything special, they just feel that sympathy and then they cry for the his friends. But once they grow to a young person, they will be fighting for that justice and desire to help those who are oppressed. These things make it cry. It is more related to the child actually, because they are not able to do. And then the sad, hopeless stage, when I was explaining your constrictum, I told you it is the first stage when they are sympathetic and they want to help the people who are oppressed. But once they see that the system is not able to be changed, they have their own pattern to go, they become very sad and hopeless. So that's the pathology in which their mind develops. And here also, like calcarea phos, they have thinking of complaints aggravates. This is something we can see somewhat very commonly, especially in case of children. When they are doing something, they don't remember about their affections. Like a few days before, a baby was brought here as a patient, and this baby had actually eczema almost all over the body. And you give something in the hands of the baby to hold something, even if it is like here we didn't have any toy items, but we gave pencil, pen, all those things. At that time the baby won't be scratching himself, he will be playing with those things. And even mother was saying that the child will be a much won't even touch his body or scratch his body when some toy items are given to him. But the moment the baby is sitting very lazy, like not doing anything, like an idle, at that time he starts scratching all over his body. So eczema was initially only over his flexor region, that too I think the elbow, and only in the cheek region. But because he started scratching all over, this eczema was like spreading from not eczema. It's not like it will spread from one part of to another. Eczema is not like that. But because of his constant scratching, that constant irritation, the skin eruption started appearing in almost all parts of the body. So this thing, when we deviate his mind from that to some other activity, he forgot to scratch. And when he is doing nothing, then only he is remembering. So that is what, which means that feel complaint more when thinking about that. And calcarea force, it is having throughout for all the symptoms. And this one in calcarea force, we can also connect it to their mental symptoms, because they mentally also they are very much affected of their disappointed life, love, involuntary sigh. So when thinking about them, maybe that is affecting their mental symptoms, their emotional, and then it affects the whole body physically. But in case of constrictum, when they think of complaints, it aggravates, but it is especially hemorrhoids, more towards hemorrhoids, one particular complaint. Then in case of Hepar self, we have done it yesterday, like it is hypersensitive, uh, getting irritated easily, very violent, sudden impulse to kill, even to throw the child in the fire, hypochondriacal. extremely sensitive into the cold air, that imagine he can feel the air if door is open in the next room. Then there is ferociousness and also hasty speech. So something that to be remembered over here is hypersensitive and irritation and violence to kill, even to kill. Then in case of respiratory symptoms, calcarea carb, it can be given for pneumonia-like complaints. So it will be usually affecting the tall, slender, rapidly growing youth and affecting the upper part of the right lung, upper third of right lung. When I say this about Calcaria carb, the constitution, I'm very sure you would be noticing that we generally tend to say Calcaria carb are a fair, fat, flabby constitution. So in case of children, it is right. Maybe also in adults or yeah, adult baby females or even males. But the thing is, usually in case if Calcaria carb has to be given for tuberculosis, and tuberculosis, because it is a wasting disease, we can see emaciation also in them. That is why the tall, slender, rapidly growing youth, the constitution suddenly change because of the disease tuberculosis, and tuberculosis being a wasting disease will be changing their constitution. Or rather, we can also connect it light. If we see around, we can see that there will be children who will be like a Calcaria cup constitution, that fair, fat, flabby constitution. Uh, they were not unhealthy or something. They were just maybe single son or something. The mothers were making them eat too much, and the children also had the habit of overeating, and as a result, the child was always this fatty. But once they reach into adolescence and they became conscious of their nature, we can see a kind of dieting. I mean, around us, okay, I'm not saying about the medicine, but the people, the nature of the people around us. So we can see once they reach into their adolescent period, when they are very much conscious about their looks at their appearance, they may go into a stage of getting emaciated or getting fit. But after leave that stage, the same people when they get into 25 or 30 years old, we can see they again putting up weight because they were genetically actually that having that tendency for obesity. So calcaria carb is generally having that tendency to obesity, but either due to their habit, not habit, because of their intention for a good appearance during the adolescence, they may get into lean constitution. But however, in the before to it, the childhood stage and later to it, post 30, they may have that obesity. But when it is indicated, calcaria carb is indicated for tuberculosis, usually it will be for those constitution who are tall, slender, and rapidly growing. Even though rapidly growing, it won't be growing any not strong muscles. It will be just flabby. Some deposition might be taking place initially and then leaving it off. And that is connected to the tuberculosis, which is a wasting disease. Then there can be shortness of breath, especially when the patient is climbing upwards or ascending up, or even physical exertion. There will be painless hoarseness, which is aggravated in morning. And we can see the same hoarseness in case of causticum also, which is aggravated in morning. So the common symptoms are put in not like this. In case of calcareous phos, this is also an important medicine for phthisis or tuberculosis. There is fistula in ano alternating with chest symptoms. Calcareous phos, when we say about phthisis, of course, all the other symptoms like their constitution, their mental symptoms, then their anemic nature, their defective nutrition, it should come around there because defective nutrition that also we can connect to tuberculosis. But here I just considered only the important, the concerned respiratory symptoms only. So for their concerned respiratory symptom, this will be the important feature, the fistula in ano alternating with chest symptoms, which means fistula which is present in the anal region. When that is present, they won't be having any chest symptoms, or it's only If there are chest symptoms, there won't be fistula in ano. So that's a characteristic feature of calcareous phos. Then all other symptoms should be adding into it the constitution. Then Causticum, in their respiratory complaints, there will be mucus accumulation in all the upper respiratory structures, larynx, phthis, catara of throat, eustachian tube. Mucus in throat cannot be expectorated, must be swallowed. Yesterday, when we were discussing about Hepar sulph, we also saw the same symptoms. But in Hepar sulph, it was more like a croup, inflammation that is happening in the upper respiratory tract. And here in Causticum, more than a group, it will be due to that paralysis. Not that the person will be having that extreme paralysis leading him to death, but still there will be a kind of paresis, the respiratory muscles feeling weak, and hence they are not able to raise that mucus. So it is getting fit or tightly, not tightly, it is getting restricted within that mucus tube itself. They are not able to expectorate it because the nervous system and also the muscular system is weak. And in Hepar, the accumulation of expectoration is there, but the causes are different because of the inflammation. The pathway, its lumen, has got reduced, and hence it is not able to come out. So, though both are having same symptoms, the etiology is different in both. And in this cough is with rawness and soreness, and we saw that this is a common feature of Causticum. They will be having that pain as if some muscles have been exposed, and with that, that rawness and soreness. Cough with expiration, with pain in distant part, and that is actually in the hip region actually. So cough which is ameliorated by drinking cold water, cough remaining after pertussis, and if at all there is expectoration, that is at night. Then hoarseness and aphonia, that too due to paralysis of vocal cords, aggravation in morning. Then in case of Hepar sulph, the cratera we saw the croup, which the cough, the mucus would come up at the croup, which is aggravated in early morning hours, or the cough. The chronic asthma, that special attitude taken, that is the head bending backward. Sputum can be any, it can be scanty or it can be tenacious, pus, bloody, whatever, it will be having that carry-on like odor. Then in the throat with the person, Hepar sulph will be having that quinsy, leading to even hardness of hearing, and the splinter of fishbone sensation in the throat region. Then going towards the child, marasmus or GIT in Calcarea cup, indicated in marasmus of children who are fair, fat and flabby. They have a tendency to put on excessive flesh, but they are not strong. They are not physically strong. It is just some carbohydrate or protein or even the fat getting accumulated, but it is not making their body strong enough. These children are physically weak and sluggish, but mentally active. Only a few, only a few, but mostly Calcarea Cup children are slow in comprehension. It's told that we can better say like uh, it's not they are as smart as like a Ignatia or an Atomir baby. You say something and suddenly they will understand everything. They are either very slow, dull. You can get that Calcarea Cup baby also because of that carb component, or there can be another set of Calcarea baby who are generally very slow to understand. Like we say one time, they were not going to understand, but we make them sit with us. Like in a class, if a teacher is teaching and 25, 50 students are there, and she is teaching just once or twice, so this Calcarea baby will not be understanding like that. But make that baby, that's why we say slow in comprehension. But make that baby sit with us like a personal tutor or something, and then teach two or three or even four times. Then the child will be understanding. So that is the comprehension of Calcarea Cup. They are very slow in comprehension and to do the things. But once they understand, they will be picking up. But every new thing, they will be very slow in comprehension. And towards, and when it says mentally active, the personalities can change actually. That is why, not that they are becoming suddenly very mentally active, not like that. But these children, we are sticking with the calcarea cup children. But when the child is developing and getting into a teenage or adolescent, when they start thinking, the calcarea cup baby will be interested in philosophical thoughts, like from where the God has come, the where the God is now, where the people are going after dying, where the people are coming from, the like philosophical questions. They start thinking like that. So maybe that they say it as, some authors say it as mentally active, because they are thinking those thoughts which we don't have answer for. But the comprehension as such is like this. It is very slow. Then they have a strong desire for eggs, especially the boiled eggs, and indigestible things like chalk, pencils, etc. There is defective assimilation of calcium, giving rise to defective nutrition, which we can see in glands, skin, and bone. So glands, the scrofula will be affected, or the lymph glands. On the skin also, and bone. And bones, we know that the bones will be having, it will take time for the ossification to take place. So the bones will be generally very weak. They will be having open fontanelles. Children are very slow in teething and also walk late. Defective nutrition and indigestion, or with malnutrition, the calcarea cup patient generally feels better when constipated. Then emaciated children with big bellies, so the typical marasmus or kwashiorkor appearance. Dull, lethargic children who do not want to play. All their discharges are profuse, often sour. So this sour nature we can see in all the other drugs also, like all the four drugs now we are going to discuss. Calcarea carb we are discussing now, they have got sour nature. Yesterday we discussed Hepar. We saw that sourness, the sour smelling stool, and even the whole body smelling sour. Even Hepar has got that symptom. Causticum is also having, and we see that in Calcarea phos also there is. So the sour nature is very much constant in all the four remedies. Um, that is one of the reason why it make a child a child remedies, and also good for malnutrition, or in other words, marasmus. So there is loss of appetite, but when he begins to eat, he relishes it. Dislike fat, aversion to meat, milk, and boiled things. Milk disagrees. And when we say boiled things, it is aversion. It doesn't apply to the egg. Boiled egg, they like very much. It is other boiled things. For example, the boiled potato. When we say this boiled thing, we should remember that this medicine was initially discovered or proved in European countries by Hanivan and others. And the eating style of the people over there is very different. They still eat most of their food rather than fried or spicy, like the Southeast Asian, like us. Unlike to that, they have food mostly that is frozen, and they are just warming it up or just boiling it off. So that is the kind they are explaining. But when it comes to egg, calcarea cup, they do like boiled eggs, but not this boiled vegetables, boiled potato, smashed potato, all those things that they are aversion to. They have a disagreement to milk, so lactose intolerance. And their sweat is also very characteristic. They have a sweaty head, and that will be very offensive. It's a chilly remedy and taking cold at every change of weather. Similar symptoms we can see in Hepar also. But in Hepar, the sweating is not giving any amelioration to their complaints. And add modalities. I have not added modalities in any of the drugs. So when you write, add the modalities. In Calcarea phos, the constitution change, it is more of dark complexion, dark hair, dark eyes, thin spare subjects instead of fat. So in Calcarea phos, more than the Calcarea, we see the symptoms of phosphorus. Phosphorus is having that thin spire nature, that delicate body. We can see in Calcarea phos the appearance of phosphorus more prominent. However, phosphorus is actually very fair, blonde, delicate, but here Calcarea is having a dark hair, dark complexion, and they are very anemic also. And anemia, it can be followed after acute disease or chronic wasting diseases. So this one, Calcarea phos, more than Calcarea carb, is indicated in tuberculosis. Anemic children who are peevish have cold extremities and also feeble digestion. Children are emaciated generally, but with sunken, flabby abdomen. Indicated in marasmus when there is a history of malnutrition, poor assimilation of nutrients. They crave for bacon, ham, salted and smoked meats. There will be flatulence, and that flatulence is temporarily relieved by sour irritations. So we don't see that their discharges are sour over here, only that the irritations are sour in taste. Then there will be great hunger with thirst, heartburn, easy vomiting in children. At every attempt to eat, there will be colicky pain in the abdominal region. Diarrhea can be the from juicy fruits, and also during dentition. Stool will be green, slimy, hot, sputtering with fetid flatus. Fistula in ano, alternating with chest symptoms. This is something characteristic symptom of Calcarea phos that we shouldn't forget ever. Then generally, we already discussed that there can be a affection of the bones. So the slow development of bones and muscles, and children are unable to stand. They also have delayed milestones, slow teething, and slow in learning to walk. The similar symptoms we can see in case of Causticum also. But Causticum, it is yeah, due to this one also. What is that? The defective nutrition, but it is also due to their paralytic nature, the muscles being very weak, not just because of the nutrition, but the nutrition being affecting the nervous system, and the nerves are not capable enough to transmit the impulses, and even the muscles are not able to respond. So that is the reason for the slow walking, talking, etc. in Causticum. So coming towards Causticum, we have the scrofulous affections and chilly constitutions over here. The children will be with slow milestones, as like other remedies, the delayed milestones we say in Calcarea carb, Causticum, and also Calcarea phos. When we see like that, Hepar Sulph is not having such slow in milestones. And we see that the child, he can totter, stumble when they are walking, and when they are talking, it can be stammering also. They will be puny. Puny is weak, and again they have repeated the same word. Emaciated body, delicate and anemic. It can be given for marasmus or any malnutrition condition, and that is affecting the nervous system also, not just the JIT or the blood or the muscles, but the even the nervous system is getting affected of this malnutrition. There will be hypertonia, muscle weakness, and loss of muscle control, and that can result in constipation and also enuresis. They don't have control in passing or micturition, passing urine, and we can see in children there is enuresis or bedwetting. The defective nutrition of the nerve system can end in convulsions or paralysis. So we see either epilepsy or paralysis of single parts, especially in Causticum. Mentally, they are very weak, irritable, least thing worry makes them cry, timid, afraid of strangers, dark, or going to bed alone. These are the features mostly in children. They are very responsible and obedient also, can't bear injustice, but their reaction will be coming up only in their adulthood, not in the younger age. Then the complaints are mostly mental. CF can also mean clinical features. So, okay. So anything, grief, worry, shock, fright, joy, frustration, anger, vexation, anything, long continued or even sudden emotions can produce their complaints. Then their constipation, hemorrhoids, the stool passes only while standing. So that's the special body posture they take up when they are passing stool. Then when the stool is ultimately passed, so generally in case when we say marasmus or any wasting disease, what we are expecting is diarrhea. Usually what we study in medicine is also diarrhea, because the food is not assimilated properly, so we are expecting a diarrhea. But in case if it is like all the other symptoms matches the nervous system and whatever we discuss the mental features, and the campaign it is not a thing like all the children who are having marasmus or any malnutrition should have diarrhea itself. Nothing that they can't have diarrhea, there is nothing like that. I mean, if all the symptoms, I mean all the diseases and all the patients were having the same diseases, they were going to show the same symptoms, we Hahnemann would have never come up with this thing of individuality or homeopathy. So we know that even when a fever comes, any disease, though we say tuberculosis or anything, all the human beings who are having tuberculosis or any disease, they don't have all the symptoms that we study in the medicine books. Only a few will be a few symptoms will be more in certain constitution, less in certain constitution, absent in constitutions, and even contradictory also. So if we are getting malnutrition, though we always say it is diarrhea, but we have the constipation symptoms and passes stool while standing. It is going towards, we need to go those medicines which will be having malnutrition, but also not the diarrhea, but constipation. So that's the importance of causticum, where we have passing that uh, constipation in a malnutrition condition. And finally, when the stool is passing, that will be covered with mucus. Um, in children with nocturnal enuresis, we also saw that we already mentioned enuresis, so I'll remove this sentence. Causticum is also helpful when there are contractures and deformities in the limbs. In case of Hepar Sulph, the torpid lymphatic constitutions, we saw that. I don't think we need to memorize, I mean, explain again. So here, if it is indicated in marasmus, the constitution is almost somewhat matching. We told like a calcarea carb constitution, torbid, lymphatic, etc., light complexion, and flabby in nature. But here, when it is indicated in marasmus, that characteristic feature, Hepar Sulph means the first thing when someone asks you Hepar Sulph, the first thing that you have to remember, like every sentence when we hear, there is some catchy word or a key word which will show the whole crux of that drug. So the whole crux For Hepar Sulph, if we have to say in one word, that will be its tendency to separate everything, every separation or abscess or a condition in which pus has been accumulated. One of the remedy we need to keep in our mind for differentiation will be Hepar Sulph. So indicated in marasmus when there is tendency to separate and form abscess. We know that in case of marasmus, when there is protein loss that is happening, even the skin, its texture will be lost and they will be prone to develop many infections. So that part of the medicine we know from the medicine textbooks. So when the infections are coming up and this infection has a tendency to develop into suppuration, so those cases of marasmus is where Hepar Sulph comes up. So these children, so then we are connecting the marasmus to that manner. So I hope you understand with this connection how we connect if it is Calcaria carb and Calcaria phos, how we connected marasmus to the GIT, their direct symptoms, their dislikes, aversions, and their um, not agreeable with type of foods. We saw like that the defective nutrition. And then we came to another drug, the Causticum, how the marasmus or the malnutrition, it affects the nervous system and then the related symptoms, be that epilepsy or mostly the paralysis, and how that other symptoms are coming up. And in case of Hepar Sulph, we are more concentrated like the marasmus is there for the baby, but if the symptoms of suppuration, all the infections getting converted into suppuration, if that is getting more prominent, then and the set of remedies. So these children, so this is a feature that you need to find out, Farah, and for that you have to constantly read everything. When we say, when I was actually a BHMS student, I used to confuse with the symptoms. Why every word same symptoms, so it's just one symptom different. But when we go deep reading and different books reading, we understand the pathophysiology is different or the etiology is different. Not like the etiology and the pathophysiology that I'm connecting with the medicine textbooks, not that. This one in homeopathy, how it is happening, how we are developing, uh, that things get different. Not only this one now I just came up and then I told you, whichever we deal, I see that connection, I will be saying you. But when you read also, you can find out more things. It's by self reading we find a lot of things. So yeah, so these children when they have that skin complaints, so from the marasmus we went to the skin complaints for the indication of Hepar Sulph. They will be sensitive to touch, cold air, prone to catch cold easily, the irritable nature, peevishness, offensive smelling discharge, especially the carrion like odor. Then there is a longing for acid things. They have that sour smelling too. So all the drugs we have seen that sour nature. Child smells sour. It is especially useful in cases when there are chronic recurring infections. Then add into it all the other H features, especially sweating, because the sweating is highly characteristic in Calcaria carb also, and hence we have to mention the sweating, how it matters in Hepar Sulph also. The fourth comparison will be with skin, so Causticum and Hepar Sulph. And I've just mentioned the skin symptoms solely. So in skin of Causticum, the cicatrices or the scars, the scalds, burns, etc., they freshen up, they become sore again. The old injuries reopen. That's the first one. The second one will be their warts, and in warts also we have two types of warts. It can be very large, jagged, pedunculated one, which is bleeding very easily and exuding moisture, or even indurated, or it can be very small pimple like warts that is present all over the body, especially on the face, nose, eyelids, fingertips, close to nails, etc. Then the eruptions that is present on the scalp, behind the ears. This one I have told you, even graphitis has got. Skin is prone to intertrigo during dentition. When we go to Hepar Sulph, it is the suppuration. Every injury suppurates and sensitive even to touch of clothes. The ulcers nature, yesterday I told you, the cancer ulcer. So the it can be given for the cancer ulcers. We saw that the ulcer and that will be filled with the pus. Surrounded there will be area of congestion or reddishness, and there will be seeing small pimples, and they will be coalescing together, which means they will never heal. In case of causticum, whatever happened that cicatrice that was formed, the scar was formed, it break open and then it is oozing again. But in case of Hepar, it is not even getting healed. The ulcer is always non-healing or angry type of ulcer. Angry type of ulcer, it means the what is that? Signs of inflammation which is present, and that is what we say with reddishness around. Difficult to heal. Then it is the bend of the elbows and popliteal spaces that are affected. Along with that, remember that pricking sensation. When I said you this pricking sensation or the splinter-like sensation, yesterday class also I told you, they have that fishbone or a splinter sensation in the throat when there is tonsillitis, quinsy, etc. But this pricking pain or a splinter pain, they can feel all over their body also in case of Hepar. Wherever there is some affections, be that a muscle ache or pain in the ulcer region, they will be having that pricking pain. But more of that we can see in their tonsillitis complaints also, but it is present all over the body. So we can see even the ulcers will be associated with pricking sensation or spindle-like pain all over. Then connected to their general feature, their hypersensitivity, irritability, and they can't bear least cold. Sensation as if cold wind that is blowing through their affected area. Now, FRS is the, I couldn't finish my preparation with FRS. But I give you that as a homework for you. I mean, you can do, you don't have to show it to me. You can do by yourself. So in FRS, calcaria carb will be coming, calcaria phos also, and causticum, and yeah, these three. Hepar is not that much important. Calcaria carb go for their constitution, the adult constitution, their Mendel features, then the menses is actually very early appearing, and that is profuse also, uh, and with um, dysmenorrhea. That's the characteristic of a calcaria carb menses. There is something important. Sudden emotions causes gushing. 1 minute. The whole cold, they always feel that chilly nature, and during menses they have that cold, damp, shocking sensation. And the least mental excitement, it brings about that menses. So that is the FRS symptoms of calcaria carb. Calcaria phos menses as such is not much important regarding the flow, but we already discussed that calcaria phos persons will be very anemic in nature, and so that anemia we can connect it to the blood flows and their total constitution. And if they are having this affections due to um, suppressed mental features, especially that disappointed love, that involuntary sighing, and then they are having some menstrual complaints, even if it is amenorrhea or even reduced, not menorrhagia. What is opposite of menorrhagia? Reduced menstruation, reduced menses flow. Then also we can think about calcaria phos. So calcaria phos will be more towards those symptoms, the anemia related. Then regarding causticum, their constitution, their nature will come, and even their menstrual complaint. It's not the menses actually important. Yeah, it is actually the timing of menses. The menses, it appears or it flows only during the day and ceases on lying down. That makes the menses of Causticum important along with the whole constitution. So make that by yourself. And then the next thing we will go will be with the next set of drugs. I'm closing this. This is the next list of drugs. Are you able to see this? Okay, that has not been shared. 1 second, 1 second. Are you seeing this, Farah? Okay. So the next drugs for our comparison is this one: carboveg, carbo animalis, carbonium sulph, beretta carb, and graphitis. And I think once we do these drugs, let I go to your 1 second, your course outline. I think once we do like this, then it is family that we have to go into. It's 5364. Yeah, it is only this thing, carboveg, and this group that we are doing, which having that carb factors together that we'll be dealing. And after that, it is family wise we have to go. The Cali group, the Natrum group, the Nozots, then Sepia group, but yeah, we can go to the mollusk wise. Then the snake group, lac, and also this one. What is that? Mm, spider group. So this is the last group of medicines which we have to deal with the carbon components. So coming up, uh, now also you are seeing this document, right? Okay, because I am changing screen to screen. I'm not sure what you are seeing. So these drugs, holy carbonium sulph and graphitis we have to discuss. So today we'll discuss only about graphitis. Next week we'll discuss about carbonium sulfuratum, and then we go through the comparisons like this. The different symptom, different systems, and which are the common drugs coming underneath. And then, so even though I'm not mentioning carboveg, carbo, animalis over here, the comparison time we will just go through like calcarea carb and calcarea phos we did now, like that we will do. Okay. So graphitis, the common name is plumbago or blacklead. Chemical property, it is an allotropic modification of carbon. Graphitis is a crystalline form of the element carbon. Graphitis being one of the forms of carbon, it is therefore related to carbo animalis, carbo veg also, and that is why it is coming for our comparison, even carbonium sulfurate. And because this contains a little bit of iron, graphitis is also connected to ferrum. Preparation, it is prepared by triturating black lead from finest English drawing pencils. Prover is Henneman. So the characteristic feature of this drug is the first idea of using this substance uh, by Henneman. I mean, this was told by Henneman that his idea to use this substance as a drug come from S. Wainhold, who was led to it by seeing workmen in mirror factory use it as a local application for titters. Titters is like a very itching eruptions, can be compared to scabies or eczema type. Uh, and he saw that people who are working in mirror factories, they will be using this graphitis for titus. And then Ruggery, which is another physician of the initial time, he also followed Wainhold. And in case of Ruggery, it was given both internally and externally. Hugh Flat relates the cure of a lady by internal and external use of graphitis and acne rosacea, which had defied all other modes of treatment. So Hahnemann, after seeing all these treatment histories with all these physicians in the earlier times, he was quick to perceive that graphitis should be more than a mere remedy for skin infection. So not just the skin, because Wainhold mainly restricted or limited graphitis to skin complaints. Ruggery, though, followed him. He was giving it internally also, but we don't know whether he had given it for some internal complaints or for the skin complaints itself, but internally also. That for what is that for that he gave that internally? We are not sure about it. And Hugh Fland is also saying about a cure that he had made on the skin sphere. So Harriman, he believed that it is a remedy, it should be having more than skin affections. And then he went on proving another remedies like sulfur. Graphitis is also proved to be a leading antibiotic. We can compare this feature of graphitis to even Hepar sulph. So Hepar sulph, though it may be have started with the uh, features that sulfur is the so skin complaints might be the, but and we see some skin complaints, the suppurations, etc. in Hepar sulph, but Hepar is more deeper, producing more intense symptoms. So clinically, graphitis, it is a polycrust actually. So head to foot, any symptoms we can think of giving it, but still these are the main sphere of action. And ailments from grief is a characteristic feature. There will be fear and also overlifting. That's ailments from uh, for graphitis. And constitution of graphitis is more or less like similar to all the other fatty, chubby constitutions that we have, like calcarea carb, sorry, calcarea carb, pulsatilla, antium crude, Hepar sulph, all the chubby, torpid, lymphatic constitutions. That is how even a graphitis patient is. So they are fatty person or obese persons, chilly in nature, very much, I mean, cold being in their temporal, temporal, I mean, chilly nature and also costive. Costive, it can be connected to the constipation. Affections of glands, skin, and mucous membrane, especially at orifices, or rather the mucocutaneous junctions, where the mucous membrane and the skin is joining that orifice region, they have predilection. Lymph glands are affected, they are swollen, so scrofulous conditions we can think of. Like the skin, the mucous membrane are also cracked and fissures, and they have scanty secretions. There is this patient, though they are fat, they are as anemic as like pulsatilla. So there is irregularity in the distribution of the blood. There will be pallor of skin and also mucous membrane. They have defective oxygenation. Subsequently, there is decreased animal heat, or they actually in nature, and always cold indoors or out. Graphitis is suited to women who are inclined to be obese, who suffers from habitual constipation. Chlorotic in nature, chlorotic means they are anemic in nature with a history of delayed menstruation. So it is told that what pulsatilla is at puberty, graphitis is at the climacteric. The graphitis condition is not sensitive, and herein it differs from Hepar, which has extreme sensitiveness of affected parts. Because when we come into the skin complaints, uh, the medicines that could be used for comparisons could be Merxol, then graphitis, petroleum, sulfur, and Hepar. Sometimes even calendula also. But calendula being a organ remedy, completely organ remedy or a local remedy. It is not usually asked. These are the remedies which are asked to compare. And the important feature of all these remedies that what I told you now, um, Hepar, graphitis, petroleum, Merxol, sulfur, even sorinum, all of these remedies, they have a common feature that the skin is very sensitive, very unhealthy, and every injury suppurates. All these remedies have that. And because of that single sentence, all these remedies for an exam may be asked for comparison. I mean, this can come not just for exam in your future practice also, the different types of skin. So that's why it is already, I mean, it was mentioned here that that graphitis when we compare with Hepar for the skin complaints, one of the most important feature that you have to keep in mind is this hypersensitive nature of Hepar, which is not seen in case of graphitis. Then in their mind, they're really depressive patient. Okay, they are not at all violent like Hepar. They're more or less very depressive persons. Their tone of mind is very sad and foreboding. The senses are abnormally acute. They cannot tolerate the smell of flowers. Music causes weeping, like in aconite, sabina, etc. Sensation as of a cobweb over the face. So they will be always scratching here on the face region as if to remove that cobweb. More of a neurotic symptom it is, or a, like a neurological or a psychiatric symptom. They're very timid, unable to decide, apprehensive, despondency, want of disposition to work, thinks of nothing but death. So when we say this timid and indecisive nature, the apprehensive, despondency, we can relate it to pulsatilla. So graphitis, constitution, the physical appearance, the mental features, it matches with pulsatilla. Along with that, graphitis is also having a history of delayed menstruation and even pulsatilla. That is why this sentence came up. What pulsatilla is at puberty, the same is the action of graphitis during the climacteric period. There is fidgety while sitting at work. Fidgety means they will be constantly moving their hands or even legs, but mostly it is the hands. Sorry, it's mostly the legs. Children are impudent, teasing, laughs at reprimands when they are very indecent children, but not as indecent and as irritating as like that of Sina or Chamomilla. They will be very mannerless children, but like even when we are scolding them, they will be laughing like a mocking at us. Uh, and when we say this one, laugh at reprimands, now that you learned Ignatia, you might be remembering in case of Ignatia, the child when reprimanded is scolding actually. So child when reprimanded, in case of Ignatia, he will go to sleep and he will develop convulsions or epilepsy from that. Not epilepsy, convulsions. But in case of graphitis, when they are scolded, they just smile at us, making us more irritated. Not irritated, making us more angry. Then regarding the skin feature, we also do have symptoms regarding its GIT. But I didn't mention it over here. It is skin that I have discussed. Oh, so I like to discuss more of graphitis in the next class. We'll go through that. Okay, some symptoms are coming up. We'll see. So skin, it has a particular tendency to develop the skin phase of internal disorders. The characteristic feature will be the oozing of thick honey-like fluid or very uh, sticky type of uh, moisture or oozing out from those eruptions. The skin of graphitis is very rough, hard, and dry. Can be eczema or herpetic eruptions. Eruptions on the occiput. that can exude gluey humor or gluey fluid, which is thick and honey-like. And this eruption and on occiput, I don't know if you remember, I always say you that the eczema that is seen behind the ears. Many of the patients they have such symptoms. So this eczema that is seen behind the ears, we have now seen in Hepar and then petroleum graphitis. So you need to know how to differentiate those symptoms. Then cracking and fissuring is one of the characteristic feature. Wherever the skin is the or the mucous membrane, and that is why we called or we told it as its action is more prominent in the um, orifice region, because wherever there is skin and mucous membrane joining together, because they have a tendency of producing ruggets or rather cracks and fissures, it will be very prominent to see. So there can be eczema of eyelids, even the eyelid region over there we can see fissures. The lids will be red and margins covered with scales or crust. Eczema of nose, and there also we see the fissures in nostrils. Moist eczema around mouth and chin, and we can see the fissures also in this commissure region. Then there will be eczema of ears, moisture and eruptions behind the ears. Moist eczema around anus, it will be with excoriation, which is fissures or cracking around anus, and also the fissures will be present over there. Can be given for excoriation between toes or athlete's foot, cracks in nipples, mouth, between toes, anal region. Unhealthy skin, every little injury separates. And that is why I told you a lot of comparison comes over there. Now we can fill those medicines having this symptom. Most importantly, then this is a good remedy for vents. Vents, it is a old terminology which is used for sebaceous cyst. There's another condition which is similar to vents. So we need to differentiate actually. Vents it's sebaceous cyst, and another one is similar, almost similar in appearance, like a nodes or nodule we can see on the body. That is ganglion. For ganglion, uh, one of our best remedy is rupta. Then they also sweat, but it is very offensive. Like calcarea carb or Hepar, it is not being told that it will be sweating profusely, but they sweat, and their sweat is actually offensive, and it stains the skin or the dress the person wearing yellow. The nails, the cracking and fissuring, we can see in the nails also. But when it becomes cracking and fissuring in nails means it is actually brittle, crumbling, deformed, like antimcrude, pain, painful, sore, as if ulcerated, and it will be thick and crippled. Can be also given for indurated tissues, aids in the absorption of cicatricial tissue. earliest stage of keloid and fibroma. So see here we have some similarity with Causticum because in Causticum it was cicatrices breaking open. Similar symptoms we'll see here also, but however, this is a good remedy for keloid, fibroma, and aids in the absorption of cicatricial tissue. So yeah, that what I told you. This is also having recrudescence of scars or old cicatrices break open again. And the other remedy now we have here is Causticum. Then this can be given graphitis for swelling and induration of glands, induration of ovaries and uterus. So any complaint because we told that it is already given during the climacteric period, not exclusively climacteric. It's not that graphitis can be given only for a woman during the menopausal stage. No, but usually this many of its feature will be coming towards the middle age. That's why connecting to the female symptoms, the term menopausal that come over there. So at that time, if there is, because it is having action on glands also, and we saw in glands it is mostly producing that growth, the psychotic growth and also induration. If we see some cancerous condition of ovaries and uterus, which is also seen towards the middle age or the menopausal time, we can think about graphitis. So the cancerous conditions affecting ovaries and uterus or even the mammary gland. So breast cancer also. When it is swollen and hard, we can think about graphitis. There will be hard cicatrices remaining after mammary abscess, retarding the flow of milk. So after two mastitis, several attacks of acute mastitis, if it is leading towards a cicatrice formation, we can think about graphitis. Cancer of breast from all scars and repeated abscess, even the nipples will be so cracked and blistered. There can be gouty nodosities, the podagra or tophi, then phlegmonas erysipelas. The deeper layer of the skin will be affected, skin and the subcutaneous tissue, which will be having a burning and stinging type of pain. And then regarding the other symptoms or the some guiding symptoms, we can say that the suffering parts emaciate. It is very important. Whichever parts that this is being suffering, uh, there will be an emaciation seen because and that also we can connect it with the general tendency of indurations of cancer development. So cancer being a wasting disease, that emaciation is pronounced. So only the suffering parts. Then they, for them, the milk agrees well, especially hot milk. There is aversion to meat. They have another important feature that is hardness of hearing, especially when riding in a carriage. Hardness of hearing ameliorated when riding in a carriage. There is diarrhea of thin, offensive, and partly digested stool. But however, it is the constipation that is more common in case of graphitis. The stool being in lumps coated with mucus. So here also we see symptoms similar to causticum. Not just causticum, okay. Other remedy which is having the stool covered with mucus, highly characteristic is aloes. But in aloes, it is more of due to hemorrhoids, even in causticum. Even in graphitis also, it is due to the presence of hemorrhoids. The stool that is ultimately coming up, it will be coated with mucus or with mucus threads. But why here the comparison causticum comes is because I didn't put aloe over here, but just causticum. One thing is that is because we saw the other symptom with causticum, that is the cicatrices breaking open and graphite is aiding its absorption. So because of those symptoms, the two to three symptoms we are having similarity between Causticum and Graphitis. I put that symptom. I mean, I put Causticum over there. They have got uncontrollable sexual excitement with violent direction, priapism, and impotence. However, they have a decided aversion to coitus. So this aversion to coitus we can see in case of pulsatilla also. Not that they have aversion to coitus, it is due more of effeminate nature they are showing, and I have explained you in one of the class what is effeminate nature, the tendency to dress like a woman. So pulsatilla, they will be having aversion to their own sex, or they may be scared of getting into intercourse. So graphitis, they also have decided aversion to coitus. So that is why graphitis and pulsatilla always in some features and in some graphitis and causticum. And in skin also, because of the tendency to separate graphitis and Hepar. In females, candid menses form a keynote indication when found associated with other complaints of headache and skin affections. Morning sickness during menstruation, the person will be very weak and prostrated. Leukorrhea is also characteristic, which is very gushing and excoriating. Excoriating means it is more of a acidic or a low pH, we can say. Whichever part it is passing through, it will be burning those regions. That is the meaning of excoriating. And also acrid. Then, so the part of the body through which this leukorrhea is flowing, like if it is moving toward falling out on the leg region, that area will be getting excoriated. The skin will be moving off or become reddish, inflamed, etc. And this leukorrhea is more common before and after menses. Modalities aggravation in open air, during and after menstruation, in wind, warmth, etc. Amelioration, hot drinks, especially hot milk, and even from wrapping up. So this feature, that extreme sensitivity to cold, we can see even in case of what is that remedy, Hepar, or even Calcareca silicea. Why did I put this sentence over here? So that's all for today. I think we'll stop here.